Alexis, good morning.
Good morning, Dan. Thanks so much. If you're thinking of heading south for a quick procedure, you know what I'm talking about, maybe plastic surgery, well, you might want to think twice. Joining me now this morning is Dr. Samimi, board-certified plastic surgeon with RevivaMed. And good morning, doctor. Thanks for being with us.
Good morning, Alexis. Thank you for having me.
We're talking about safety when it comes to plastic surgery because nowadays it seems like people are trying other alternatives which may not be the best option.
Well, you know, this is a good time to talk about it. The holiday season tends to be a very busy time for men and women to do plastic surgery. And unfortunately, there's a lot of things out there that, you know, they need to be aware of. And overall, plastic surgery is a very, very safe, has very safe procedures, but there are some things to look out for.
Okay. Tell us some of the safety tips.
The safety tips, first of all, I think you have to look at yourself. You have to be really, really realistic about what you're expecting and what can be accomplished. Plastic surgeons are not magicians, and there's only a limit of what we can achieve, and you will never be happy if you actually have too high of an expectation.
Okay.
When it comes to the actual procedure, I think this is over and over emphasized, but I say it again, check your physician's qualifications.
And how do you do that?
You know, you can go on the web, you can look on their listing, what the state has listed under the license, but most importantly, make sure they're a member of an accredited board like the American Board of Plastic Surgery, the American Board of Facial Plastic Surgery or Dermatology. Make sure they're a member of a approved or recognized professional organization, such as the American Society of Plastic Surgeons. And then use your gut instincts and make sure you can communicate with your physician.
As we listen to the rest of these tips, let's show some pictures of work that you've done. You say that it's also important when you're getting a procedure done like this facelift, perhaps, to stay local.
Yes, there's a tendency of many people to try to save a few $100s by crossing the border or going abroad. And I spend a lot of my time fixing some of these mistakes, and in the end it costs thousands of dollars more than what a person may have saved by going abroad. Not to say that there's not good surgeons there, but overall it's very important to be close to your surgeon, to actually have good follow-up care and be able to reach him when you actually need to reach them.
I can't help but looking at some of the Us Weeklies and the magazines out there when you see these celebrities that do 5, 6, 7, 10 procedures at one time. Do you recommend that?
Generally not. I think we have to keep in mind that there always is a risk with plastic surgery, and adding more and more procedure, increasing the length of these surgeries, does significantly increase the risk. Now, it is safe to combine procedures, but it is also important to do that in a safe environment. Do it in an environment where this can be done, where maybe you can even spend a night in the hospital or in an observed setting.
What about procedures or products being used that aren't necessarily FDA approved? They're in the trial process, they're a test drug.
Well, I think if the physician is knowledgeable about them, as long as he discloses that to you and you're willing to take that risk, that unknown, that's okay. But there also are products out there that are not FDA approved and that are being injected. And keep in mind, these stay in your body for a long, long time. And I've seen some very, very bad outcomes from this. So again, make sure you actually check what is being injected.
Okay, and then finally we'll scroll to the next board. I love this because it applies so well. If it sounds too good to be true, it probably is.
Plastic surgery, again, there's a lot of advertising, and a lot of it, most is very truthful and correct, but there are things out there that I sometimes wonder about.
Yeah.
We cannot do a facelift at lunchtime and have the same result as a good facelift. And there always is recovery, and there's always risks, even with what we call minimally invasive procedures. So again, keep in mind what you want to achieve, and that you have to be careful how to do it.
Okay, Dr. Samimi, thank you so much for joining us.
Thank you, Alexis, for having me.
Great advice. Okay, take care.
Thank you. Bye.
Okay, we're going to take a quick break. We will be right back with more on Good Morning San Diego.